Doctor's going to go ahead and discharge you, but first I have a few instructions. For yourself, adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. You should eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For your activity, you should gradually increase your daily activities until you are back to your normal routine. Rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you are released by your physician. Your breasts and nipples may have changed and or grown in size during your pregnancy. Wearing a well-fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. If you're not breastfeeding, you should wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. If you are breastfeeding, your baby's mouth should form a tight seal. The lips should be against the areola, not the nipple. If the baby is sucking incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. You should nurse as long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, even though it won't be for very long. It is important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing include hearing your baby swallow without a clicking sound, seeing movement above the baby's ears. The ears may even wiggle, and that is normal, and not seeing dimples in your baby's cheeks. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but there should be no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. Regarding hygiene, you should wash your hands frequently as you are caring for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It is important you change your pad frequently. For bleeding, vaginal flow will decrease in an amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. For bowel movements, you should avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet to prevent constipation. Birth control, you should discuss these options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Regarding sexual activity, nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. There are some warning signs that you will need to report to your healthcare provider immediately, and these include pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision, or if the incision begins to open. Discharge from the vagina that has a bad odor, severe headache or blurred vision or visual changes, temperature over 100.4 degrees Fahrenheit, or if you feel cold or feverish and have the chills, if you have thoughts of harming yourself or your baby, if there is a pain or burning sensation, redness, warmth, or swelling in the legs, if you have breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms, if you have sharp pains in your abdomen, breast, or chest, if you have trouble breathing, dizziness, or faintness, if you have crying spells or mood swings that feel out of control, if you are unable to empty your bladder or urination that is painful, difficult, or too frequent, or if you have difficulty having a bowel movement. And if you need to report domestic violence or abuse, you can call 1-800-96-ABUSE. And some instructions regarding your infant. For safety, while sleeping, you should place your infant on his or her back to sleep. You should use sleep clothing, such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should also not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. For the bulb syringe, you should keep it near the infant at all times to clear the infant's throat or nose if necessary. After using, you should clean the bulb syringe well with warm, soapy water and allow it to air dry. You should wash hands prior to handling the neonate. For the car seat, all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. Some safety precautions for your home include the use of outdoor announcements. Is not recommended to announce the birth because they call attention to the presence of a new infant at home. You should question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Regarding your baby's behavior, as for crying, it's a normal response for your infant to cry. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Some calming techniques if the baby is crying include feeding your infant, changing the diaper, gently rubbing his back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Sleep patterns. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tummy time. Tummy time will strengthen his or her neck and abdomen. For the diet, if you're breastfeeding, your infant should breastfeed 8 to 10 times a day per infant cues. Regarding positioning, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled, and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. If you're formula feeding, your neonate should be receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. For positioning, you should be sure to hold your infant close to you while feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Burping, infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Some characteristics of a newborn include a newborn rash. It is normal for your infant to develop a rash on his or her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially on the nose. They will disappear within the first week of life. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow or jaundice in the next 24 hours, you need to call your healthcare provider immediately. Some infant care. For bathing, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant-type soap may be used on your infant's body. Umbilical cord care includes keeping it clean and dry. Cleanse it with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes, and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. For diapers, 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow, and they will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. For the genitalia, if your baby is a female, you should always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. If you have a male baby and he is uncircumcised, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. If your baby boy is circumcised, always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and re-diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider immediately. The plastic ring method of circumcision does not require a dressing. That ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad and plain water. For dressing, you should dress your infant as you would yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. And as for vaccines, infants should receive all recommended vaccinations. Do you have any questions?
No.